Philips, a health technology company, just released its annual survey looking at the state of the space from the perspective of both physicians and patients. Joining me now with more on the results and solutions is Philips Chief Innovation Officer, Shez Partovi. Shez, welcome.
Thanks for having me.
It's great to have you here at the New York Stock Exchange. And with this report just out, what are the key takeaways?
Well, this is the 10th year that Philips has done the Future Health Index. And this year we surveyed 1,900 clinicians and 16,000 patients across 16 different countries. So an impressive data set. And what was one of the most sobering things that came out of this is if you look at the voice of the patients, 3 out of every 4 patients said that they wait over 2 months to get specialized care. And if that wasn't alarming enough, 1 in 3 patients said that while they're waiting, they end up going to the hospital. Now, if you turn and look at the voice of the clinician, that was interesting as well. So clinicians said, look, despite advances in technology, that when I compare my work to 5 years ago, I'm still spending half my time doing administrative work. And a third of them actually said, I'm spending more time doing administrative work than 5 years ago. So this is actually quite worrisome because with all the advances that we've had over the past 5 years, our goal was to actually reduce the burden on clinicians. So it seems that the industry, we still are overburdening them with administrative work.
How can technological advancements like artificial intelligence improve the health and well-being of patients?
Well, this is where AI has an incredible opportunity. And when you look at the survey, there was incredible optimism in the clinicians. So about 85% said, look, AI can automate things that I shouldn't be doing. That administrative tasks, they want AI to just automatically make it go away. And so if that is done, the survey said, look, I'll have more time with patients, procedures can be faster, I can have more face-to-face time and get back to giving what patients and physicians want, which is this interaction directly. The other thing that came through was about 82% of the clinicians said, we believe that AI can help predict conditions and help avoid them. And this idea of predicting conditions means that you can avoid hospitalizations, improve care delivery, and they said that we believe AI can help increase the accuracy. So when you put that together, clinicians believe that AI can help deliver better care for more people, which is an encouraging part given the headwinds that we've also seen in the survey.
How is Philips using AI?
So Philips has been leveraging AI for quite some time, and I'll give you an example of the automation that we've been doing that actually aligns with what physicians said they want. So if you go and have an ultrasound of your heart, the sonographer will spend 20 minutes scanning your heart, and then they look on the scanning machine and they try to find the best images of the heart, and then they go ahead and try to measure, they do little clicks and measure all the different parts of the heart. It takes 20 minutes, and then they get a number of how the heart stress is doing. So 20 minutes of scanning and 20 minutes of clicking. So Philips, for example, in our Epic Elite ultrasound machine, there's an AI software that with one click automatically finds the best image, does all the outlining of the heart, does all the measurement, and gives the number that's needed. And so this means you can have either shorter exam, you can have more face-to-face time, you reduce wait time backlog because your exam's gone from 40 minutes to 20 minutes. And this is an example of automation that helps deliver better care for more people.
I want to talk about the trust gap. I'm not sure if AI plays into that, but what are you finding when it comes to the trust between physicians and, of course, patients?
Yeah, the Future Health Index had some really interesting data on the trust gap. So when you ask clinicians about if they are optimistic about AI, 80% said they are. In fact, you see the survey in many places, they're very optimistic. You ask the same question from patients, and only about 60% were optimistic. So there's about a 20% trust gap. And when you sort of dive into it a bit more, you see the little subtle nuances there. So patients said, look, I trust AI for things like scheduling, for check-ins, where sort of operational work. But if you want to make a diagnosis and you want to treat me, I want a physician in the loop. In fact, the trust gap reduced when they said, if the decision is informed by a clinician, then I trust it more. So physicians and nurses, 80% trust, patients 60%, but if the patients, if you add a clinician in the loop, their trust came back up to 80%. So clear signal from patients that there's some things I'm okay with, scheduling, that sort of thing, but if it's about my care, AI should be informed by a clinician in how you treat me. Very, very specific.
Very interesting. What will it take to advance the adoption of AI to help with critical healthcare matters?
Yeah. So first and foremost, keep humans in the loop. I mean, the patients have spoken, right? The patients have spoken, which is why in the document we call on having human-centered collaboration between AI and humans so that the trust gap can be reduced. That's one area that will increase adoption and increase the trust. There is another area that 3 out of every 4 clinicians said, look, there is unclarity around regulations and liability, and you have to help clarify that for us, which is why another part of the document we called for not only maintaining the pace of innovation, but the regulatory bodies need to bring greater clarity so that it can be clear on how we can bring this innovation to patients. So those things will increase the speed of adoption.
We've spoken a lot about artificial intelligence. What are other trends or innovations that you think will shape this industry over the next few years?
This is a great time to be in healthcare. Look, with the advent of generative AI, we have entered the age of intelligence. Society's gone through the industrial revolution, the digital revolution. We are now in the midst of an intelligence revolution. And what that really means is that it's the first time that you can have reasoning, you can have understanding. And so as an industry, health tech, med tech, we have an opportunity to add that kind of technology so that the equipment and the software that we build isn't simply displaying data, but actually is providing additional insights. For example, we're going to be at a point where an MR scanner doesn't just scan the patient, but actually says the Alzheimer's is getting better. The CT scanner doesn't just scan the patient, but actually activates the stroke protocol and reserves the ICU bed and notifies staffing for nursing that there's a stroke patient coming. These kinds of things are automations that are going to happen as the trends with generative AI coming in. It's a great time to actually have a positive impact on healthcare. If you want to make a positive difference, this is the time, and Philips wants to deliver better care for more people. We are thrilled to be here.
Shez, thank you so much for joining me. Such an insightful conversation here at the New York Stock Exchange.
Thanks for having me. It was a delight.